Welcome. You are in module number 2. What is Wise Woman? A program overview. This online training is provided by a partnership between the South Carolina Office of Rural Health and South Carolina DHEC's Best Chance Network and Wise Woman programs. This is the Rural Training Series. My name is Tiffany Simpson-Crumpley, and I will serve as the moderator for today's session. And the session contributor is Linda Peccary, the statewide Wise Woman Program Manager. By the end of this learning session, participants will learn basic information about the Wise Woman program that will include eligibility requirements, core program services, and financial benefits for providers who offer these program services. The content for today's presentation has been provided by Linda Peccary. She is the statewide Wise Woman Program Manager. She is a native of Brooklyn, New York, and has been with DHEC since 2013. She has 26 years of public health experience. She is a graduate of the University of Minnesota and holds degrees in nutrition and dietetics, as well as a master's in public health. I will serve as your presenter for today of the content. My name is Tiffany Simpson-Crumpley, and I have a 20-year background in community health program management and training for not-for-profit organizations and government entities in 3 states, California, North Carolina, and South Carolina. One might ask, why cover Best Chance Network program information first? The reason being is the Wise Woman program is offered as a companion program to the Best Chance Network program. So a provider must be a contracted Best Chance Network provider before they can offer Wise Woman program services. Just a quick review from module number 1, the Best Chance Network program is the program that provides comprehensive screening and diagnostic services to prevent breast and cervical cancer to low-income, underinsured, and uninsured women. It is often referred to as the free mammogram program in the community. What is the Wise Woman program? WISE Woman is an acronym for Well-Integrated Screening and Evaluation for Women Across the Nation. Since 2008, DHEC has offered Wise Woman programming to provide health screenings and lifestyle education for women 40 to 64 years of age to help reduce their risk for heart disease, stroke, and diabetes. BCN and Wise Woman programs are offered as the dynamic duo to offer comprehensive screening to at-risk women due to clinical linkages between uncontrolled high blood pressure, obesity, and the development of cancer. Wise Woman provides preventive services and referral to lifestyle education programs. It also provides screening at no cost to participants who meet the eligibility guidelines. Screenings measure blood pressure, cholesterol, blood sugar, body weight, and waist and hip size. Medical referral and follow-up visits are provided as appropriate. Wise Woman also provides education to participants to address factors that increase their risk for heart disease or stroke, like poor nutrition, lack of physical activity, and smoking. Wise Woman program eligibility. The woman must be enrolled as a BCN patient first and be a South Carolina resident. She must be 40 to 64 years of age and have no insurance or has high deductible and or diagnostic insurance that covers less than 100% of services or hospitalization coverage only. Income must be at 200% below federal poverty level. The eligibility income guidelines are the same for Best Chance Network. So this is a screen that provides family sizes ranging from 1 to 8 persons. And for households with more than 8 persons, please add $10,450 per person. WISEWOMAN is critical in providing preventive services as well as saving lives. On the map here, you can see the heart disease death rates across the state, with the upper PD region, Marlborough, Dillon, and Marion counties being most adversely affected by heart disease. So it is critical that more women receive WISEWOMAN services, but also that the number of providers are increased as well. In the Low Country, Allendale is impacted as well negatively by heart disease rates. And closely behind that are areas in the upstate, Low Country, and more counties in the PD. WISEWOMAN statistics. Heart disease is the second leading cause of death for all women in South Carolina and is the leading killer for African American women in the Palmetto State. In 2013, 4,351 women lost their lives to heart disease. An even staggering 23,065 women were hospitalized due to heart disease. In 2013, the cost of hospitalizations due to heart disease for women in South Carolina totaled $1.24 billion. The goals of the WISEWOMAN program are to provide low-income, uninsured, or underinsured women 40 to 64 years of age with the knowledge, skills, and opportunities to improve diet, physical activity, and other lifestyle behaviors to prevent, delay, and control cardiovascular disease and other chronic diseases. Funding from the WISEWOMAN program is administered through the Centers for Disease Control and Prevention Division for Heart Disease and Stroke Prevention. South Carolina is one of only 21 WISEWOMAN programs funded by the CDC. Many providers may think that a self-pay patient may not serve as a potential source of revenue, but by providing Best Chance Network and WISEWOMAN program services to an eligible woman, a practice can earn over $400 for one initial visit, with additional revenue being offered for revisits and return visits for coaching and counseling through the WISEWOMAN program. How can WISEWOMAN benefit your practice? Increased revenue from initial screening appointments and follow-up for both programs. For WISEWOMAN, patients can receive free diabetes prevention education and lifestyle coaching to promote healthy eating and physical activity. The services provided through the WISEWOMAN program aligns with other quality improvement measures such as PCMH, HEDIS, QRS. This also allows for better reimbursement by these payer sources for implementing this program. This screen just provides examples of how services provided through WISEWOMAN neatly aligns with the patient-centered medical home program. Medicaid reimburses up to $2 per member per month for practices that are successful in implementing these standards. Also, for meaningful use, practices receive credit for controlling high blood pressure, comprehensive diabetes care in terms of routine HbA1c testing, and comprehensive diabetes care and blood pressure control. These are further examples of how providing WISEWOMAN service also aligns with HEDIS measures, and it allows providers to renegotiate their contracts based on better performance. Also, if your practice is going through the quality payment program, these are also credits that are given to practices that provide services through the WISEWOMAN program. For more information about becoming a Wise Woman provider or questions that you have in the implementation process, please contact Linda Peckery. If you are not a Wise Woman provider and would like to sign up, please contact her as well. If you have any questions about the Best Chance Network program, please contact Dr. Trinessa Jones. And I'm Tiffany Simpson-Crumpley for training consultation. And LaShonda Pettaway Brown provides on-site technical assistance to practices that are looking to implement both programs. You have completed module number 2. What is Wise Woman? A program overview.